Hi, y'all, and welcome. This is Professor Truelove's Concepts for Nurses series, and I am Professor Terry Truelove. And in this episode, part of the rehabilitation concepts, we will look at some of the interventions required by the nurse to treat the patient within the rehabilitation settings. Sources for this episode include Iggy's Medical Surgical Nursing, 9th edition. In many cases, the patient who is admitted to rehabilitation will have deficits in mobility and strength. Therefore, one of the primary things the team can do is work on range of motion and endurance. That is, work to improve flexibility and strength. Some of the strategies include pacing activities, that is, doing some activities, allowing some rest, doing some activities, planning those activities in advance, using assistive devices whenever possible, including but not limited to braces, crutches, and devices to extend the use of a specific body part, and teaching and maintaining the use of proper body mechanics. This is also important for the healthcare team, including the nurse. Well, these techniques all help to improve physical mobility, and some of the techniques for those to improve physical mobility include proper transfer techniques from chair to bed, bed to chair to commode, etc. Proper gait training for balance and safety. Making sure the patient is able to use proper wheelchair mobility skills and not put themselves in danger because of recklessness. And also proper range of motion techniques. In some cases, the patient doesn't have proper sensation and can actually injure themselves if they aren't concentrating on how to properly move their body and maintain proper body alignment. If the healthcare team also implements these techniques, this will result in safe patient handling practices. You should know that heavy lifting and dependent transfers by staff result in a very high incidence of work-related musculoskeletal disorders, that is MSDs. So not only can the patient become injured because of improper techniques, but the staff themselves can be injured as well. After doing a proper skin assessment, it's important that the healthcare team work to maintain skin integrity. The best intervention to maintain skin integrity is frequent position changes with adequate skin care and sufficient nutritional intake. All patients should be turned or repositioned at least every 1 to 2 hours. Do not forget to monitor patients in wheelchairs. They may not have sensation in areas like their buttocks and legs, and this could cause pressure injuries if the nurses aren't careful. Depending on the patient's lack of mobility or the lack of ability to be mobile, there is special equipment to maintain skin integrity, and here's a couple of examples. These are pressure relieving devices called specialty beds. Skin integrity can be impaired by the presence of urine, so bladder retraining is a very important intervention in rehabilitation. And this is the retraining or repatterning of voiding. It is facilitating or triggering techniques such as using Valsalva or Creedy maneuvers. It may include intermittent catheterization to keep the bladder as drained as possible. There may be consistent scheduling of toileting routines, in other words, simply providing toileting to the patient and reminding them they need to go. There could be a drug therapy involved, including but not limited to things like cholinergics, antispasmodics, and skeletal muscle relaxants, and carefully monitoring the patient's fluid intake. Some definitions on urinary incontinence. You should know the spastic or reflex bladder, that is from an upper motor neuron problem. This is incontinence with sudden gushing voids. A flaccid or areflexic bladder from a lower motor neuron injury is urinary retention and some overflow, that is dribbling. And an uninhibited bladder, which is similar to reflex, this is a neurological problem that affects the brain's bladder center in the frontal lobe. Continuing with the concept of elimination retraining is bowel training. It can be a combination of suppository use and consistent toileting schedule, that is, reminding the patient they need to sit and go to the bathroom, with using such medications like bicosodal, maintaining fluids and fiber, providing for a bedside commode, and even maintaining things like fiber through Metamucil, all to encourage the soft passage of stool. These interventions should help to address a number of common problems, including impaired physical mobility, self-care deficit, risk for impaired skin integrity, impaired urinary or bowel elimination, and ineffective coping. And this is because patients with a disability often have a poor self-concept. Listen, the use of assistant devices also makes the patient different from others. They stand right out. A disability affects a patient's role in society, and their roles in relationship with others change. These interventions that we have discussed are designed to deal with these common problem statements. That does conclude this episode, but don't worry, there are more episodes to come. In the meantime, I hope you learned a little bit. I hope you plan on coming back to listen to some more, and if you are, we'll see you then. Take care now.